This is an article that just came out in the New York Times, September 2nd, 2017. I'll leave the link to this article in the description box. Fentanyl overtakes heroin as leading cause of U.S. drug deaths. Drug overdoses killed roughly 64,000 people in the United States last year, according to the first governmental account of nationwide drug deaths to cover all of 2016. It's a staggering rise, or more than 22% over the 52,404 drug deaths recorded the previous year, and even higher than the New York Times estimate in June, which was based on earlier preliminary data. Drug overdoses are expected to remain the leading cause of deaths for Americans under 50, as synthetic opioids, primarily fentanyl and its analogs, continue to push the death count higher. Drug deaths involving fentanyl more than doubled from 2015 to 2016, accompanied by an upturn in deaths involving cocaine and methamphetamines. Together, they add up to a plague of drug overdoses that is killing people at a faster rate than HIV epidemic at its peak. And you can see fentanyl estimated 20,100 deaths, heroin 15,400 deaths, prescription opioids 14,400 deaths, cocaine 10,600 deaths, meth 7,660 deaths, methadone 3,280 deaths. And this is between 2000 and 2016. This is the first national data to break down the growth by drug and by state. We've known for a while that fentanyls were behind the growing count of drug deaths in some states and counties, but now we can see the extent to which this is true nationally, as deaths involving synthetic opioids, mostly fentanyls, have risen to more than 20,000 from 3,000 just 3 years ago. And you can see on this chart, they're estimating it for 2016, the deaths at 64,000 people, which surpasses car crashes, HIV, and gun deaths. That's why I laugh every time the trolls come on here talking about black on black crime. Your drug plague have far outpaced black on black crime. At the rate that you're dying, you're going to wish you were dying at the rates of black on black crime because you have long passed it. Deaths involving prescription opioids continue to rise, but many of those deaths also involve heroin, fentanyl, or a fentanyl analog. There is a downward trend in deaths from prescription opioids alone. At the same time, there has been a resurgence in cocaine and methamphetamine deaths. Many of these also involve opioids, but a significant portion of drug deaths, roughly one third in 2015, do not. The explosion in fentanyl deaths and the persistence of widespread opioid addiction have swamped local and state resources. Communities say their budgets are being strained by additional needs for increased police and medical care, for widespread naloxone distribution, and for a stronger foster care system that can handle the swelling number of neglected or orphaned children. Now, so much for calling black women bad mothers. Woo, you guys are really sinking to a low level. It's a plague hitting different parts of the country in different ways. People are accustomed to thinking of the opioid plague as a white rural problem, with accounts of Appalachia, despair, and the plight of New England heroin addicts. But fentanyls are changing the equation. The death rate in Maryland last year outpaced in both Kentucky and Maine. This provisional data compiled by the National Center for Health Statistics was produced in response to requests from government officials after reporting from the Times in June. An early version of the report was posted online last month and will be formally published by the NCHS in the coming weeks, according to Robert Anderson, the agency chief of mortality statistics. The document is the first edition of what will be a monthly report on the latest provisional overdose death counts. My problem with that is we already seen previous articles where if a family makes the request, they won't even put the drug death on the death certificate. They'll put something else on there. So those people are ultimately not counted as a drug death when they really should be. Because of delays in drug death reporting, the data is mostly, but not entirely, complete. The final numbers released in December could be even higher. It's too early to know what 2017 will hold, but anecdotal reports from state health departments and country coroners and medical examiners suggest that the overdose plague has continued to worsen. In March, Trump created a commission to study the crisis. The commission interim report made a number of recommendations, but the administration has yet to take concrete action on any of them. And remember, they were the ones that reported it was 142 deaths per day from the drug plague that's hitting the country. And here is a chart right here that shows drug overdose deaths per 100,000 residents in 2015 and 2016. And you see Maryland, wow, which is shocking to me, way at the top. And then you have Kentucky, Delaware. And Maryland and Delaware are actually small states. So it was 21 states that reported the highest quality data for 2016. The steepest rises were Delaware, Florida, and Maryland. Okay, so it's just showing the states where it had rise, and it's showing you where it was before and where it is now. Like Maryland was at 21 drug deaths, now 36. So you can see every single state rose except for Nebraska down here on the bottom. They had a slight decrease. It's not a big decrease, but they did have one. Okay. Please tell me what you think, ladies and gentlemen, in the comment section. Please leave your comment and subscribe. And if you can donate to my channel, please do. And as I stated before, I'm looking for more patrons. So if you can become a Patreon, it will be deeply appreciated. Peace, family.